Hello everyone, it's Dr. Aaron Seaton with the Chiropractic Place. I wanted to talk to you about a subject that most people don't really associate with chiropractic care, and that's babies and chiropractic. When babies are born, they rarely have the ability to hold their head up. What that means is their neck doesn't really have musculature that's protecting it yet. And when babies are born, the delivery process is not only can be difficult for the mom, but can be very hard on the baby as well. They've actually done studies on this to determine whether or not there are issues in the neck after delivery. And this was done with not only pediatric chiropractors, but pediatricians and OBGYNs as well. They found that over 80% of the newborns that were checked had misalignments in the top of their neck after delivery. So that means about 4 out of every 5 babies that are born can have spinal misalignments at birth. Why is that so important? If you know and have watched our video on the nerve system and chiropractic care, you already have an understanding of this, but we'll do a brief review. The spine is what protects our nerve system. It's like the armor around it to keep it safe. The nerve system is our brain, our spinal cord, and all of the spinal nerves that exit out at every level, which control and coordinate everything in our body. Here's an example just of the spine, where if a bone shifts and puts pressure on that nerve, it can choke off the flow of information from the brain to the body. Remember, the brain is controlling it, sending signals to the body, and if those messages can't get there, then we can have a problem with the development of a newborn. So we find this typical symptoms that can show up in babies that are really struggling with this. They tend to favor one side. Their head likes to be on one side when they're sleeping. If they're nursing, they tend to favor one side versus the other. They have trouble moving their head to the other side. They can come off as very uncomfortable, like groaning and crying as they're very physically uncomfortable. They might squeeze up a lot and trying to move. They might be having some digestive discomfort. There's a lot of things that can happen with newborns when we start to see it after birth that they're just not quite happy and comfortable. They're just not quite developing the way we want them to. And the real one is really looking to see, are they having trouble moving their neck? Are they liking that one side? Or maybe it's they're like being to the left. This is why having newborns checked by a chiropractor can be so important, because we don't want to start our children off at birth with a health issue like that. Nobody wants to have a cavity when they're born. Nobody wants to have misalignments when they're born, because that direct pressure on the nerve system can create development problems and growth problems in a child that all they're doing is eating, sleeping, pooping, and growing. So we need them to be able to do that effectively to develop the way we want them to. So what we do with babies, because a lot of people think we're just, are we aggressively adjusting babies? When you see a newborn, the force that I use is typically with my fingers is the same as you at the store checking the ripeness of a tomato. That's the amount of force used, not a lot of force. I've adjusted babies who are asleep in their car seat and do not flinch, move, or wake up at all when we perform the adjustment. It's very gentle, it's very safe, and it can be very effective, because babies, they don't have years of chronic problems, right? They're a couple weeks old and sometimes days old when I see them and check them for this issue. We have seen truly amazing results with our babies when we adjust them. If your baby is having any issues like this, or you have just some questions about this, because I understand this can be a scary subject if you're new to chiropractic care or don't understand how it would work for a baby, I'm happy to answer those questions and go over that with you and talk to you about what that would look like for your baby. If you have any questions, give us a call. Aaron Seaton, the Chiropractic Place.